Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, osteoarthritis is the most common form of arthritis affecting millions of people worldwide. Well, although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips and spine. So to discuss on this, we are being joined by Dr. Chetan Kabra, Senior Orthopaedic Surgeon from Apollo Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show at this point in time. And today the topic which we have taken is osteoarthritis, which is seen very commonly in some of the people, and it has been heard along in your career as well. So on first note, if I would like to ask you, what is osteoarthritis? To tell our viewers, what would be that?
Thank you, Puja, so much for inviting me today. Well, osteoarthritis, if I have to explain in a very simple language, is nothing but a wear and tear of the joint. For example, you buy a car and the car gets older with age, So it's a very similar thing. Our joint is being utilized constantly by us, and as we get old, there is a lot of wear and tear, and this wear and tear of the joint is actually in simple form is called osteoarthritis.
All right, so this is in general, our viewers of course must have an idea, and what a good example you have given at this point in time, Doctor. So if I would like to ask you that a common joints involved in osteoarthritis, so what would be that?
As you yourself mentioned very clearly, like knee joint is the most common joint which is involved in osteoarthritis, especially in India. In rest of the world, even hip joint is very commonly involved, but in Asia, most of the Asians, knee joint is particularly involved in osteoarthritis. The other joints which are commonly involved are the spine, the foot, the hand, the joints of the hand, but invariably it's the knee joint which really troubles the patient the most.
All right. Now, these are some of the things like our viewers who are watching our show must be benefited with the answers, and we have just started our show. So our numbers are flashed on your television screens, viewers. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask a question. I'm sure the doctor who is with us at this point in time must be able to give you all the answer. All right, doctor, coming to you again. Now, if we talk about who are more prone to osteoarthritis, what is the age group do you see these kind of problems which is emerging?
Well, if we talk about statistics, it's 70% most commonly seen in females compared to 30% of males.
Okay.
And there are quite a few factors which are responsible. Some are the factors which we cannot change, and there are certain factors which we can change. For example, if there is a family history of say osteoarthritis, then the chances of having osteoarthritis increases considerably. Again, like if you are overweight, for example, which can be changed, so overweight again plays a very important role. So weight is an important factor. Being female, you cannot change. If you are a female, the chances of having osteoarthritis increases significantly.
Okay.
Generally, it is commonly seen above the age of 45, more commonly among females.
All right. Now, doctor, if a basic idea has to be taken up by any of the person to know that he or she is suffering, especially you were mentioning that this is seen basically in females. So if a female has to understand that she is going through an osteoarthritis problem, so what would be the basic symptoms or basic causes or symptoms she has to know that something is wrong with her and she has to immediately see an orthopedic?
Well, the most common symptoms which the patient mention, like whenever they suffer from osteoarthritis, is like when they get up from the floor. For example, they suppose like they are sitting on the floor, or they are sitting on a chair for a while. So when they get up, they feel this pain around the inner side of the knee joint.
All right. Inner
also,
side
there is a clicking sound coming from the knee joint, which commonly patients complain. The other symptoms which the patient commonly complains are like whenever they are climbing up the stairs, there is a lot of pain they feel. But the single most important sentence which they invariably say is whenever they get up from a chair or say from the floor, that's when they experience the excruciating pain, mostly on the inner side of the knee joint. So that is the specific criteria, more commonly among females, generally above the age of 40 years, most commonly above the age of 45 years.
All right. Now, in that mode of time, like if suppose that a person feels that pain, so immediately what should that person do to have a bit of like a normal ease or a little bit of a satisfaction? So, because immediately that person can't go to a doctor. So, at that point in time, what suggestions do you give to that patient?
Well, I generally tell my patients that listen to your body.
Okay.
Your body is actually telling you very clearly, don't sit on the floor or don't sit for prolonged duration. Every 15-20 minutes, get up, walk a little, stretch your muscles, relax, and then sit. So avoid prolonged sitting, avoid sitting on the floor, avoid sitting cross-legged. So you have to listen to your body and do quadriceps strengthening exercises. Basically, what happens is with age, our knee, it becomes weak. So we need to keep it strengthened all the time, and the best way to do is by doing quadriceps strengthening exercises.
All right, so exercises is a must in every there and in every diseases as well, and also in osteoarthritis. All right, doctor, if we talk about the prevention part, how to prevent osteoarthritis, what would be that?
Well, the best way to prevent osteoarthritis is by walking very regularly and at the same time maintaining a specific weight. You should not be overweight or obese. And if you are regularly, constantly doing quadriceps strengthening exercises, any running, after a certain age, if running increases your pain or like any vigorous activity which increases the pain, if we can avoid it as soon as we realize that it might cause damage to our joint, that can really make a huge difference.
All right. Now, you were talking about walking regularly. So, is that possible for a patient who is suffering from osteoarthritis? Walking regularly means for morning walks, that a person can easily go for morning walks and all?
Yes, definitely. In fact, every osteoarthritis patient, we actually recommend to walk at a normal pace.
Okay.
We should not be brisk walking, we should not be running, but at a normal pace, we should definitely walk. I generally tell my patients, you wear a very nice sports shoes, wear a knee cap, especially while walking, and then walk for at least half an hour to 45 minutes every day. When you walk, what happens is, what basically happens in osteoarthritis is the liquid, the grease formation which happens inside the knee, it reduces. So when you walk, that little bit of grease which is left inside the knee will make a small layer, and it will like act as a, it will avoid friction of the joint.
Okay.
So walking is very essential. At the same time, walking increases the strength of your knee joint.
All right, so it's very essential. All right, doctor, we have a caller at this point in time. Let's take the call and then we will proceed with the conversation. Hello.
Hello, মোৰ মাৰ মানে কি হৈছে ভৰি এখনত এনি টাইম ক্ৰেম্প হৈ থাকে মানে খুব ভৰিখনত ধৰক খোজ কাঢ়িব নোৱাৰে এনেকে পাৰ্মানেণ্টলি আঁঠুৰ বিষ বা ভৰিৰ বিষ তেনেকে একো নাই কিন্তু ঠিক আঁঠুটোৰ তলত অলপ ক্ৰেম্প এটা হয় তেখেতৰ এক্সৰেও কৰোৱা হৈছে নাইবা বাকী টেষ্টবোৰো কৰা হৈছে চব ঠিকেই আছে কিন্তু বিষটো আছে
Okay.
The cramps can be because of your calf muscle, and it can be because of your lower back pain also. Sometimes when there is a nerve compression happening in the spine, especially in the lower lumbar spine, it can lead to cramps. And if this cramp is basically because of walking, if suppose she is walking a lot and then she feels the cramp, then probably like strengthening exercises should help her.
All right.
Maybe
Doctor,
evaluation will help. Generally,
Absolutely.
cramps below the knee joint is not very common with osteoarthritis.
Okay, doctor, we have different kinds of callers, so they ask in their probable and comfortable language. So if it is possible for you to reply them in their comfortable language, be it Hindi as well, that would be also fine.
Sure, definitely. I'll speak in Assamese or Hindi, like whichever the patient like.
Absolutely. All right, thank you so much for calling at this point in time, viewer. And numbers are flashed on your television screens. And if you have any queries regarding the osteoarthritis, we are having a possible discussion at this point in time. Please call up and ask your question. All right, doctor will come, but after this short break, viewers will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Puja, and we are having a fruitful discussion with Dr. Kabra on the osteoarthritis. All right, Doctor, coming back to you again, we had a possible understanding regarding the prevention of osteoarthritis. Now, if I would like to ask you that there is a notion among the people, confusion among the people regarding knee replacement. Now, is knee replacement the only treatment in osteoarthritis? What do you have to say?
Well, if I have to be honest, knee replacement is the last treatment for osteoarthritis.
Okay.
It's always first is the change of lifestyle. We need to modify our lifestyle. As I told, like avoid prolonged sitting, avoid sitting on the floor, avoid sitting cross-legged. So that's first thing. Second is exercises. But then if you expect there is some medicine which will cure the disease, to be honest, there is no medicine in the world which can actually, cure osteoarthritis. I generally explain my patient by giving example of gray hair. Once the hair becomes grey, you take homeopathy, you take allopathy, you take Ayurvedic, the hair will not become black again. Similarly, once the osteoarthritis has developed, it can definitely progress with age, but it will not go back to the previous stage. But then we can keep the pain under control by doing the exercises sincerely, by taking maybe painkiller on and off, not very regularly. We can apply ointment, like whenever there is a lot of pain, we can apply hot water bag. And as I told, come what may, walking is essential, not just for the knee joint. If because of the knee joint you have stopped walking, it can definitely affect your heart, kidney, liver and all the other organs.
Okay.
If you are unable to walk, if the pain is so much that you are unable to sleep in the night, so rest pain is the single most important criteria where we think about knee replacement.
Okay, but walking, as you said, that it's very important to walk because that can cure, and it's a very good exercise at this point in time, isn't it, Doctor? Doctor, we have a caller at this point in time. Let's take the call and then we will proceed with the conversation. Hello.
Hello.
আমি সুধি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
হয়, মোৰ মানে কি হৈছে, মোৰ ৰাইট সাইডৰ গুৰু হাতত পেইন এটা হৈ থাকে। তাৰপিছত মই ইউৰিক এচিডৰ সেইটো মই টেষ্ট কৰিলোঁ, কিন্তু তাৰ ইউৰিক এচিড মোক পোৱা নাই। তথাপি মোৰ পেইনটো হৈ থাকে। সেইটো কি কাৰণে হৈ আছে মই গম পোৱা নাই আচলতে। মই এক্সৰে কৰিব লাগিব নেকি? হেল্ল'।
গেৰুৱাৰ বিষ আপোনাৰ মোষ্ট কমনলি
হয়
আপোনাৰ জোতাৰ কাৰণে হয়, জোতা বা চেণ্ডেল যিটো আপুনি পিন্ধি আছে। আৰু পেচেণ্টে নৰ্মেলি কমপ্লেইন কৰে ৰাতিপুৱা যেতিয়া প্ৰথম ভৰি পাতে সেই সময়ত চবতকৈ বেছি বিষ হয়, অলপ খোজকাঢ়াৰ পিছত বিষ অলপ কম হৈ যায়। আপোনাৰ যদি তেনেকুৱা কিবা হৈ আছে, আপুনি চেণ্ডেল চেঞ্জ কৰক, জোতা চেঞ্জ কৰক আৰু অলপ কাফ মাছল ষ্ট্ৰেচিং এক্সাৰচাইজেছ কৰিব লাগিব আপোনাক, আৰু বৰফ লগাওক তাতে, আৰু ৱাকিং যদি কৰি আছে আপুনি, ৱাকিং অলপ কমাই দিয়ক কিছুদিনৰ কাৰণে। এক্সৰে ইমিডিয়েটলি নালাগে, যদি আপোনাৰ চেণ্ডেল বা শ্বুজ চেঞ্জ কৰাৰ পিছত যদি ভাল নহয় তেতিয়াই আমি এক্সৰে কৰি চাম, এনে এক্সৰে দৰকাৰ নাই ইনিচিয়েলি।
All right, thank you so much for calling at this point in time. A very important question, Doctor, there. And you rightly mentioned about the shoes and also the slippers which one wears. So that is also very important to use in your lifestyle, isn't it, Doctor?
Yes, it's a very important thing. We actually sometimes, because of fashion or because of our job profile, we tend to wear certain kind of shoes. For example, the boots which the police or the soldiers wear, or the fashion models which like the kind of shoes they wear, they make a huge impact not just on the heel but also on the knee joint and also on the lower back. So these things are very important. Whenever possible, we should wear something which is very comfortable.
Okay. All right. Now, Doctor, is there any mode of like a changing, like if a person is very fascinated with some kind of shoes or sport shoes, so can they wear some inner soles or something like that that can be helped while wearing their fashion statement as well as taking care of their feet as well?
Yes, they can wear inner sole or like soft cushion heel sole, but if you're wearing a sandal, it is almost impossible to wear it.
Right.
And most of those those heel sandals or shoes which the females wear,
Okay.
it is almost impossible to insert the silicone heel pad inside. So for males, definitely it's much more comfortable for them to put a silicone heel pad while walking.
All right. Now, Doctor, we were talking about the knee replacement, which is the last option for osteoarthritis. So if we talk about the knee replacement, is it done in Assam as well?
I mean, it's the most common surgery which is being done nowadays all over India, including Assam.
Okay.
You will be surprised, even remote areas of Assam like Gwalpara district, Gwalpara, Dhubri, knee replacement are being done even in those small remote places. So definitely it's being done throughout Assam.
All right, so if we talk about
And
the success
so far
rate of the...
Guwahati is concerned, in almost all the hospitals we do it.
all right, Guwahati is also done.
Yeah.
So if we talk about the success rate, how successful is this knee replacement done in the entire state? And if we talk about the Guwahati as well, any kind of patient which is very much satisfied with it, you must have gone through it.
Well, so far the success rate is concerned, we have to talk about statistics. Coming to statistics, the replacement, the results are good in almost 96 to 97% of the patients. Good to excellent results in 96 to 97% of the patients. Within 1.5 months of post surgery, patients are like almost pain free. The reason why I told that it's the last option is because they have a life. The knee replacement, they don't last forever. Generally, the post knee, the processes, they last for almost 15 to 20 years. So suppose the patient is very young, we generally tend to avoid knee replacement initially. Okay. We try to manage with conservative management. If the patient is say around 65, 70 years and the pain is really troubling her, then we definitely ask for the knee replacement in the beginning itself, because the results are fantastic. To be honest, the results are very good.
All right, doctor, we have a caller at this point in time. Let's take the caller. Hello.
Hello.
Yeah, আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
মোৰ মানে ankle tissue swelling হৈছে বুলি X-ray ৰিপৰ্টত আহিছে। মই এতিয়া কি হেৰি ল'ব লাগিব বাৰু, মানে ৰেমেডিজ কি ল'লে মানে ভাল হ'ব মোৰ কাৰণে? ankle tissue to swelling হৈছে।
Okay.
আপনার যদি ankle tissue swelling হয়েছে, আমাক ইনফ্যাক্ট প্রথম কারণ জানিব লাগিব যে আপনার কিয় swelling হয়েছে. If it is there in both the ankle, then probably there is nothing serious to worry. If it's only in one ankle, we have to find out the cause of it. There are multiple causes why there can be swelling in the ankle, but most of the common causes are not related to orthopedics generally. So we have to actually, I will have to examine you, to be honest, and maybe then I can confirm like why the swelling is there in the ankle.
All right, it's very important to see through the patient, and definitely then only things will be worked out, and precautions can be taken, medications can be taken, isn't it, doctor?
Yeah, many a times, unfortunately, like because of this COVID thing, people want online consultations, but to be honest, like neither the doctor is satisfied nor the patient is satisfied, because sometimes we have to touch the patient to actually know the diagnosis. You know? Clinical examination is a very, very important aspect of making a diagnosis.
All right. Now, doctor, let's quickly know about what exactly is a stem cell therapy. What is, in generic, if we come to know that what is stem cell therapy, what would be that?
Nowadays, stem cell therapy is something which is used almost in all possible diseases which are like not very curable otherwise. It's a very new thing and the research is still on. It's basically we take our own blood and we insert it inside the joint, and we expect the cartilage to recover. Generally, the cause of osteoarthritis is the damage of the cartilage, and most of the times the cartilage is irreparable, and that is the root cause of your osteoarthritis pain. So stem cell basically we insert the stem cell inside the knee joint, and we expect that this stem cell will convert the formation of new cartilage, and hence there will be reduction in pain.
All right, so is it very common nowadays?
It's still in the nascent stage, and yeah, it is common nowadays. We actually take out blood from the iliac crest or like from the blood, and then like we insert it inside the knee joint.
Okay.
But the results have not been that great so far. We are still awaiting the long-term results.
All right, still awaiting for the long-term results. Now, doctor, if we talk about the role of steroids. Now, steroids, if any person hears about steroids, so a lot of questions and confusions comes up in their mind. So, if we talk about the role of steroids in osteoarthritis, what do you have to say on this?
So far, tablets are concerned, there is no role of steroid in osteoarthritis.
Okay.
When it comes to local injection, when we insert the injection inside the knee joint, it do have some role, in the sense like if suppose the painkillers are not working, and the patient is like comparatively young, so maybe like once in 3 months or once in 6 months we can give a steroid shot. It should not be given very regularly because it will further damage the cartilage. So although there is a short term relief of pain because of steroid injection, but in the long run it's actually harmful. So maybe 2 to 3 shots of like steroid can be given over a period of like say 1 year, but overall it should be avoided for the long term. Finally, knee replacement is the solution if we have gone to the stage where we have to insert steroid injection.
All right. Now, do you suggest any supplements to take to the patients, and what kind of suggestions do you give them? And if we talk about the knee braces, nowadays many of them wear to avoid like cramps or avoid those tickling in their knees. So what suggestion you would like to give them?
Well, so far your supplements are concerned, glucosamine is still the most commonly used drug.
Okay.
I mean, it's been in the market for almost like 25 years, and people, we regularly use it. Some patients definitely feel much better. So glucosamine actually again helps in the formation of cartilage. Then there are like hyaluronic acid injections.
Okay.
There are some more like Sinviscone injections. They are also helpful. But then like none of them is like 100% effective in curing. As I told, there is no medicine in the world which can actually cure osteoarthritis. Once the damage has started, it will definitely progress. We try to halt the progress or delay the progress. So somehow like these supplements do help in like delaying the progress.
Okay.
And some pain relief is definitely there in some of the patients, not all of the patients though.
All right.
So maybe like early stage when you have a knee pain, say a female around 40-45, we can start with the glucosamine tablets, or maybe like we can try with a hyaluronic acid injection.
All right, doctor. We are really short of time. So what would be your
And
last
so far-
suggestions and your advice to our viewers who are watching our show at this point in time?
Well, all I will say is a healthy lifestyle is what we have learnt from COVID. COVID has taught us very clearly that if you are healthy, you will live longer, and not just live longer, you will live pain free. So far osteoarthritis is concerned, try to keep yourself as healthy and as active as possible. Do walking regularly, do exercises very sincerely and religiously, and I am sure you will not suffer from osteoarthritis very, very soon. And all in all, if at all surgery is needed, you need not go outside Assam. It is definitely available in almost the whole of Assam, so far knee replacement is concerned.
All right. Thank you so much, Doctor, for joining today in Good Life, the Health Show, and giving those lovely suggestions to our viewers who have watched our show. Well, viewers, with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.